Hello everyone. Topic for today's presentation is infection control. Introduction. Infection control is an elimination or reduction in spread of infection from all types of microorganisms. The clinician has a professional responsibility for implementing effective infection control to protect patients and a responsibility for safe practice for all the members of the dental team. What is infection and infection control? Infection is the deposition of organisms in the tissues and their growth resulting in a host reaction, whereas infection control is a prevention of spread of microorganisms from their hosts or killing or removal of microorganisms from objects and surfaces. Transmission of infectious agents among patients and staff within a clinical environment is known as cross infection. In dentistry, the source of infection may constitute patients suffering from infectious diseases, patients who are in the prodromal stage of certain infections, and healthy carriers of pathogens. Pathways of cross infection. There are 6 common pathways. They are patient to practitioner, practitioner to patient, clinic to community, clinic to practitioner's family, and community to patient. Routes of transmission. Transmission of infection within a dental surgery may occur via several routes. 1. Direct contact of tissues with infective biological fluids such as blood and oral secretions. Number 2. Indirect contact with contaminated instruments, equipment, or environmental surfaces. Number 3. Inhalation of aerosolized infective droplets or particles. Number 4. Direct inoculation into cuts and abrasions of unprotected skin or mucosa via contaminated sharps or instruments. Infection through any of these routes requires that all 3 of the following conditions be present. The chain of infection. 1. Pathogen. 2. Exposure portal through which the pathogen may enter the host. 3. Susceptible host. Dental patients and dental healthcare workers may be exposed to a variety of microorganisms via blood or oral or respiratory secretions. These microorganisms may include bacteria like Staphylococcus, Streptococci, Microbacterium tuberculosis, and viruses like herpes simplex virus type 1 and 2, cytomegalovirus, HBV known as hepatitis B virus, and HCV and HIV. Also some other bacteria and viruses associated with upper respiratory tract infection. These are the tabulation of some infectious agents and their major routes of transmission. What should be done to prevent the transmission of disease? Number 1. Sterilization and disinfection. Number 2. Personal protective equipment. Number 3. Hand wash. And number 4. Waste disposal. For sterilization of instruments, it is classified into 3 levels. They are critical, semi-critical, and non-critical. And these are collectively together called Spaulding's classification. The critical instruments like burrs, extraction forceps, needles, files are sterilized by autoclave, chemiclave, and dry heat. Semi-critical instruments like mouth mirrors, hand piece, impression trays are sterilized by autoclave, chemiclave, dry heat, and immersion in full strength of glutaraldehyde. Non-critical devices like dental chair light handles, chair controls, sputum, instrument tray, these are disinfected by phenolics and iodophores. What is sterilization? Sterilization can be defined as the use of a physical or chemical procedure to destroy all forms of microorganisms including bacteria, spores, fungi, and viruses. The 4 accepted methods of sterilization are the following. 1. Moist heat sterilization. 2. Dry heat sterilization. 3. Chemiclave. 4. Ethylene oxide sterilization. 5. By irradiation. Autoclave is a moist heat sterilization. Materials indicated are metal instruments, syringes, metals and trays, rubber gloves, gowns, gauze, cotton. Hot air oven is a type of dry heat sterilization. Materials indicated are glass vials, glass syringes, petri plates, pipettes. Another method is by low temperature steam and formaldehyde. Chemiclave. This method uses a combination of dry saturated steam and formaldehyde to kill bacteria, spores, and most viruses. Formaldehyde play double action role by the heat and chemical. The next method is ethylene oxide sterilization, commonly called ETOX. It destroys microorganisms by alkylation process. It causes denaturation of nucleic acids of microorganisms. And the next method is by irradiation. Radiation used for sterilization is of 2 types, ionizing radiation and non-ionizing radiation. Ionizing radiation, for example, X-rays, gamma rays, and high-speed electrons. Non-ionizing radiation, for example, UV rays and infrared rays. Handpieces are semi-critical instrumentation requiring sterilization, like steam sterilization of handpieces, chemical vapor process sterilization or chemiclave, and etox gas or ethylene oxide gas. General principles for universal precautions for dental team. Number 1. Personal protective barrier techniques like gowns, face masks, protective eyewear, gloves should be used. Precautions should be taken against injury from sharp instruments. Number 2. Immunization. Vaccination should be done against hepatitis B virus with a booster dose after every 3 years. Number 3. Routine hand washing by antimicrobial hand wash. Personal protection. Protective attire barrier technique. They are clinic attire, face mask, protective eyewear, gloves. Clinic attire. A freshly laundered uniform or high necked, long cuffed. Sleeved cover gown should be used. All protective clothing should not be worn outside of the clinic areas such as corridors, canteens, and elevators. All disposable protective barriers should be discarded prior to leaving surgery or the operative area. Face masks must be worn by all the staffs during patient care. Masks should be changed when sneezing occurs, when damp, and in between patients. In addition, a chin length plastic face shield must be worn for greater protection against splatter. Head caps. Hair should be properly tied. In case hair contamination is expected, hair cover or caps must be used. Gloving. Gloving is mandatory for all type of patient care. All staff must wear gloves during patient contact, during blood, saliva and mucous membrane contacts. Gloves will minimize needle stick injuries. The disposable gloves are made of latex or polyvinyl. Sterile gloves are required during surgical procedures. For other procedures, non-sterile gloves should be worn. Over gloves or paper towels must be used for opening drawers, cabinets, etc. The contamination caused by pushing up glasses, touching the face and hair, rubbing the nose, adjusting the mask, etc. should be avoided. If contact must be made, a barrier such as a paper towel should be used or gloves removed and a new pair used before proceeding. For latex allergic patients, use polyurethane or vinyl gloves. Protective eyewear. Eyewear with solid side shields or chin length face shields must be used when splashing and splattering of blood, saliva, or pus is expected. When rotary cutting instruments are used. Environmental cleaning and disinfection. Disinfection, high level disinfection, is the term used for destruction of all pathogenic organisms such as vegetative forms of bacteria, mycobacteria, fungi, and viruses from inanimate surfaces such as walls, furnishing, and equipment. And antisepsis is the term applicable to living tissue such as skin and mucous membrane. Methods of disinfection. Disinfection by cleaning, by heat and low temperature steam, disinfection by boiling, by chemical agents. The types of disinfectants are alcohols. These are the low level disinfectant. For example, ethanol and isopropyl alcohols are frequently used as antiseptics. And aqueous quaternary ammonium compounds. For example, benzalkonium chloride called Zephyran was commonly used as both an antiseptic and as a disinfectant. And phenolic compounds, these are the intermediate level and comes under the broad spectrum disinfectant. These compounds are used for disinfection of inanimate objects such as walls, floors, and furniture. And finally, the aldehyde compounds. These are the high level disinfectant. For example, the aqueous solution of formaldehyde called formalin and glutaraldehyde, Cidex, are effective disinfectants. Dental unit surfaces and countertops should be cleaned and disinfected with a suitable chemical germicide. The chemical germicide are of two types: intermediate level disinfectant and low level disinfectant. Intermediate level disinfectant. A hospital disinfectant labeled as tuberculocidal mycobactericidal for disinfecting surfaces which is soiled by patient material. The next is low level disinfectants. A hospital disinfectant which is not labeled as tuberculocidal activity, for example, quaternary ammonium compounds, for general cleaning purposes such as floors, walls, and other surfaces. Plastic wrap or aluminum foil must be used to cover the surfaces from direct or indirect contact whenever possible. Floors should be cleaned daily. Spray wipe spray technique. Number 1. Spray the surface and or equipment with cleaner or disinfectant. Number 2. Dry the surface with paper towel and discard. Number 3. Spray the surface and or equipment with cleaner or disinfectant and leave it contact for 10 minutes. Number 4. Set up for next clinical procedure. Number 5. Clean the chair with soap and water. Antiseptics. An antiseptic is a chemical disinfectant that can be diluted sufficiently to be safe for application to living tissues like intact skin, mucous membrane, and wounds, while still retaining its antimicrobial property. Commonly used antiseptics are alcohols like ethyl alcohol, isopropyl alcohol, and aqueous quaternary ammonium components like benzalkonium chloride known as Zephyrin. Hexachlorophene and iodophore compounds are used in surgical scrub, soaps, and surface antiseptics. Chlorine compounds like sodium hypochlorite, called household bleach, and chlorine dioxide. The last part of our today's presentation is waste disposal. In a healthcare setting classification, WHO, the World Health Organization classification of waste is as follows: general non-hazardous, sharps, chemical and pharmaceutical, infectious, and other hazardous medical wastes. As per the guidelines, the bag should be labeled bearing the International Biohazard symbol. All the waste after segregation must be stored in color-coded containers. The following is the color coding prescribed by Biomedical Waste Management and Handling Rules 1998. There are 10 categories of wastes, whereas categories like 1, 2, 3, and 8 were disposed in yellow plastic bag followed by incineration or deep burial. Red plastic bag contains categories of 3, 6, and 7 which are autoclaved or microwaved later. Blue or white translucent plastic bag or puncture-proof container has categories of 4 and 7 which can be autoclaved later. Destruction, shredding, and chemical treatment can also be done. Black plastic bag contains categories of 5, 9, and 10 which is disposed in secured landfill. Category number 1 include human anatomical waste, and number 2 includes animal waste, number 3 includes microbiology and biotechnology waste, and number 4 includes waste sharps, number 5 includes discarded medicines and cytotoxic drugs. Number 6 include solid wastes like items contaminated with blood. Number 7 includes waste generated from disposal items. And number 8 includes liquid waste of laboratory and disinfecting activities. And number 9 includes incineration as from biomedical waste. And number 10 has chemical waste used in the production of biologicals and disinfections, etc. Disposal of infected waste. Like, how will you dispose the infected waste? A municipal biomedical waste service van will collect all the biohazard waste and sending it to the common incinerator for incineration and deep burial with bleaching powder or lime. And here comes the conclusion. This is concluded that the dental practitioner must follow acceptable standards in their clinics as well as hospitals regarding infection control and safety to prevent high risk of disease transmission to patient as well as the dental practitioner as well as others including the dental practitioner's family and other patients. Thank you.